Hello, this is Giuliana Nava, and today I'm here to talk to you about looking for your first nursing job and also how to prepare for your first interview. So, as many of you know, most hospitals, nursing homes, and long term facilities are only hiring after you pass your NCLEX. So, after graduation and your celebrations, make sure to get to the books and study so you can take your boards and you can pass them so you can start applying for jobs. Once you start applying for jobs, look for places that you will be interested in. If you're more of a maternity person, then look for maternity jobs and so forth. Before you apply for the places, make sure to do your research about the institution that you're applying to. Find out their mission statement, their values, what the unit that you're applying for is about. Try to find out as much information as you can. Try to find out information about the department that you're applying for. And keep record of all the jobs that you apply for, because once they contact you back, if you applied for 6 jobs in the same institution, you need to know which one you applied for and the one that they are calling you back for. In regards to your resume, always have a presentable, clean resume, and when you go for your interview, make sure to bring extra copies with you. The recruiter might have a copy with them, but it's also good to bring another one for them and one for the nurse manager that you're going to be interviewing with. In addition, you might have a interview with the staff, so it's good to also have an extra copy to give it to them so you can make some conversation about it. On the day of your interview, arrive at least 15 minutes early. Show that you appreciate the recruiter's time. Don't be late. It's very advisable for you to drive to the place a week before your interview at the same time that you're going to be interviewing for, so you know more or less how the traffic is going to be, what you can expect. Leave your house a little bit early, just in case you might hit an accident or there might be some complications on the road. Dress professionally. It's one of the big things. Make sure to wear a suit for both women and men. Make sure your makeup is not exaggerated, and no gum, no jeans, no flip-flops. Another important thing to bring to your interview is a list of your references with you so they don't keep asking about it, and it shows that you were very interested in an institution. Be able to speak about each and everything you put in your resume. Don't fluff it up. Just make sure that you put it to the point and then develop it in the interview. And always try to bring your skills into the interview and show what you've done, and try to insert pieces of information that would add to the interview that will make you look better. Make sure you mention any internships, any volunteer work, anything that outstands you from other candidates. Do you speak another language? Those are very important things. They are going to ask you in your first interview, what are your leadership qualities? What have you done that shows leadership? How did you deal with a difficult situation and how did you manage to get out of it? How do you deal with conflict? Tell me an example about it. So those are some of the questions that you should be ready for. After your interview, make sure to thank the recruiter and thank the nurse manager. It's okay to send it's actually a very good thing to send the recruiter and the nurse manager an email the day after the interview, just with a short thank you for your time, look forward to hearing back from you, and then your name. Just those extra things will keep them in mind of your interview and will remind them of you. And the last thing that I would say is be confident in yourself, believe in your skills, believe in yourself, and just know that you'll learn with every and each experience that you have. I wish you the best of luck and take care.